Hello and welcome. Today we'll be discussing paraphimosis, a urological emergency that affects uncircumcised or partially circumcised males. Understanding this condition, its causes, and treatment is crucial for maintaining urological health. So, what causes paraphimosis? Typically, it occurs when the foreskin, which has been retracted behind the glans or head of the penis, becomes trapped and cannot be returned to its normal position. This retraction may happen during bathing, sexual activity, or medical procedures like catheterization. Poor hygiene, chronic infections, and forceful retraction can also contribute to the development of paraphimosis. The pathophysiology of paraphimosis involves a vicious cycle of edema and constriction. When the foreskin is retracted and trapped, it creates a tight band around the base of the glans. This constricting band impairs lymphatic drainage and venous return. As fluid accumulates in the foreskin and glans, they both swell, further tightening the band and exacerbating the circulatory compromise. If left untreated, this can lead to arterial occlusion, tissue ischemia, necrosis, and ultimately, gangrene. Paraphimosis is most commonly seen in uncircumcised or partially circumcised males. While specific epidemiological data on the global prevalence is limited, it's more frequently observed in settings where healthcare access is limited and hygienic practices are suboptimal. Individuals with phimosis, which is a tightening of the foreskin that prevents retraction, are also at increased risk, as forceful attempts to retract the foreskin can trigger paraphimosis. The signs and symptoms of paraphimosis are often quite noticeable and concerning. The most prominent symptom is swelling and pain in the glans penis and the trapped foreskin. A visible constricting band of foreskin behind the glans is a key indicator. The glans may appear bluish or purplish due to impaired blood flow. In severe cases, there can be ulceration, tissue necrosis, and even gangrene. The patient will typically be in considerable discomfort and may have difficulty urinating. Diagnosing paraphimosis is usually straightforward based on a physical examination. The characteristic appearance of a swollen glans with a constricting band of foreskin is generally sufficient for diagnosis. However, the healthcare provider will also assess the degree of swelling, discoloration, and any signs of tissue damage. Further investigations are typically not required for diagnosis, but may be warranted to rule out other underlying conditions if the presentation is atypical. While paraphimosis doesn't have distinct classifications or types, the severity of the condition can vary. It can range from mild edema with minimal discoloration to severe swelling with compromised blood flow and tissue necrosis. This spectrum dictates the urgency and intensity of the treatment required. Treatment for paraphimosis is focused on reducing the swelling and restoring normal blood flow. Manual reduction is often the first line of treatment. This involves applying gentle pressure to the glans to reduce swelling while simultaneously pulling the foreskin forward. If manual reduction is unsuccessful, more invasive measures may be necessary. These can include dorsal slit incision, where a cut is made in the constricting band of foreskin to relieve the pressure. In severe cases, or after the acute episode is resolved, circumcision may be recommended to prevent recurrence. Pain management is also an important aspect of treatment. It's crucial that this condition be addressed quickly in order to preserve the tissue. Preventing paraphimosis primarily involves practicing good hygiene. Uncircumcised males should regularly clean beneath the foreskin during bathing. Care should be taken when retracting the foreskin, and it should always be returned to its normal position afterward. Healthcare providers should be particularly vigilant when performing procedures that require foreskin retraction, such as catheterization. Educating patients with phimosis about the risks of forceful retraction is also crucial. The prognosis for paraphimosis is generally good if prompt and appropriate treatment is provided. Manual reduction or surgical intervention can usually restore normal blood flow and prevent long-term complications. However, delayed treatment can lead to tissue necrosis, gangrene, and even penile amputation in very rare instances. Recent research is focused on refining surgical techniques to minimize complications and improve cosmetic outcomes. The use of topical medications to reduce swelling and facilitate manual reduction is also being explored.